Good evening, Facebook family and YouTube subscribers. Today is Sunday. It is December 13th, 2015. We only got a little few days left in this year. About a week ago, I had surgery on my chest. So as you see, I'm wearing this vest now, that compression garment, which is to keep my chest from swelling after having surgery. For years, at least the past 10 years, I knew I had a problem with my chest with an excessive fat. The glands in it had grown overly large, and I didn't like the appearance, the way my chest, the appearance of my chest. I hated it. And I went from doctor to doctor to doctor trying to figure out a way to correct the appearance of my chest. And I finally settled on a doctor here in Atlanta, and we spent the past year getting my blood pressure down, and I had to lose some weight to have this surgery, which I had last week before last. So this is about the 10th day after I've had the surgery, and I have to wear this garment that you see me in for the next 6 weeks, well 5 weeks now, or 4 weeks. I mean, it will be 4 weeks after Thursday of this week. I had the surgery on Wednesday, the week before last, whatever date that was. So anyway, I've been really wanting this surgery for a while because I just hated the way my chest looked. It was very sensitive sometimes because it was called gynecomastia. So I had gynecomastia surgery to remove the overly large glands under the nipples, which made my chest stand out in ways I didn't like. Because I was, even though I'm 45 years of age, please keep in mind we still live in a world where people tease and taunt people. So, I've had a lot of issues with people teasing or taunting me about the appearance of my chest. I never forget, I went to a pool party a few years ago, and a guy who called himself liking me, can you believe this, actually made the comment, looked at my chest and said, "Got milk," as if to say my chest was large. My chest, some people may think that when they look at pictures of my chest that it wasn't as bad but it was pretty bad for me. So it made me very conscious about my chest. And although I would take pictures with my shirt off, and I have tons of pictures on my Facebook page, I knew eventually I was going to have this corrective surgery, which is why I'm doing this video to talk about this, because this is gynecomastia surgery is a very common surgery here for men. It is so I actually had 3 things did. They did something like a pec lift. When they lifted up my chest, they did a liposuction of the chest, and then they did the gynecomastia removal of the glands. So the surgery wasn't bad. Matter of fact, the surgery was just a few hours. The cost wasn't that bad either. I guess the waiting game, because I had spent the past few years trying to figure out what I was going to do and when I was going to do it and what doctor was going to do it, and doing all this research, and you're researching which doctor, or hospital, and whatever, I put a lot of thought into it before I did this because I knew it had to be done right. So far, what I've seen when I take a shower and take my shirt off, and it looks great. Although I ran into some issues that the doctor's trying to correct now. Mainly, my chest is holding fluids. So the fluids are supposed to leave the body. For some reason, these fluids were remaining in my chest. I'm not sure why. Excuse me, I'm belching because this garment, I don't know if you can see this garment. This garment is kind of like really, really tight on me. And it makes me belch and burp and stuff like that. It makes me very uncomfortable. Very hard to sleep, and I have to wear this 24 hours a day, 7 days a week. I can only take it off just to hop in the shower and put it right back on. So because we're trying to keep the swelling down in my chest so that my chest will heal faster so I can get back to normal. So I guess if I was working a traditional 9 to 5, I would just put a shirt on and go on to work. But you can't lift anything heavy. I can't work out. I can't go to the gym or do anything like that for the next few weeks. But I'm kind of glad I had the surgery because, like I said, I wanted to. This is a problem I've had for at least a decade that I knew of. And I think even in my 20s, it was minor then, but it really got bad in my 30s. And the earliest I knew was probably about 2003, and I really wish I had did this operation in my 30s. But It was just, I don't know why I didn't, but I decided to wait. And it gave me time to also do some research and really figure out where I wanted to go, what doctor I wanted to use, what procedures I wanted done. I even hired a personal trainer who we aggressively worked on trying to eliminate the problem through workouts and exercise. It did help, and I learned a lot about how to the lower pecs. But ultimately, the gynecomastia was so bad that it had to be removed. And so a lot of people I do these videos because I want to educate us. My video YouTube channel is about education, us learning and understanding each other. There are many men who walk around with large, oversized breasts who have this condition, and they don't know how to correct it. The only way you really correct this is to have surgery to remove that fatty tissue, breast tissue that shouldn't be there, or swelling. So they take the tissue out, and I saw the tissue when after the surgery was over. He showed me pictures of them removing the tissue and what they took out, and I was like, it grossed me out. But I'm glad it's gone out of my chest. So now my chest is smaller for now, flatter. My nipples, which were larger, are now smaller. So I thought my nipples were huge. The areas around the nipples, the areola, whatever they call it. All that is now much smaller now and getting smaller and shrinking now that the surgery is complete. So I'm very happy with the way the surgery came out. I'm very happy with the appearance. A little uncomfortable with this vest. I wasn't really prepared to this to be so uncomfortable for the next 3 weeks. And then you can't see, but under the vest, I'm wrapped with all these ace bandages pulled super tight to force the fluids out of my chest. So I'm dealing with that. Kind of makes me not. I think I might lose a lot of weight because I'm not really hungry. I'm trying to eat food, and it's really difficult for me to eat food because it kind of makes me kind of sick. And the surgery itself wasn't bad. The few days after the surgery, I was in pain. Well, the first 2 or 3 days, I was fine. It wasn't until actually about the fourth or fifth day that the pain hit me, and I said, "Ooh, I need to take these pain pills." He gave me some pain pills, some antibiotics that I took. Given me some directions. I've talked to the doctor every day. So I'm hoping that this fluid is gone out of my chest by this Thursday, because otherwise he's going to have to take a needle and do some other things to remove this fluid. We're hoping that me continuing to wear the garment and really pull it super tight will help eliminate that, so I don't have to worry about that fluid anymore. But overall, this is a surgery I've been wanting for a while. I'm glad I went on and did it. I'm going to love the appearance of my chest over the next few months as my chest continues to heal. I'm giving myself about a year to get my chest exactly where I want it to be, appearance-wise. Maybe less, but I'm just going to give myself 12 months. I ain't rushing there. I ain't going nowhere. So, I wanted to share with you all what I was going through. This was my Christmas present to myself. A boob job. Got rid of the man boobs. They're gone. Bye-bye, never to be seen again. I know a lot of guys who've had this surgery, and they absolutely gave them self-confidence. I've seen some guys' chests that were much worse than mine. But I think if you have this problem, you should look into finding you a good surgeon who specializes in correcting this issue, gynecomastia. I think I'm pronouncing it right. Y'all know I can butcher some American words around here. I tear them up. So I'm hoping in the next few weeks I can be able to begin. I have some pictures, but I'm not ready to show y'all those pictures yet because it ain't right yet. So you're going to have to just wait for the grand unveiling of the chest, what it looks like one day in the next few months. So for the time being, for the first time ever, I will be doing YouTube videos with my shirt on. You damn Skippy. Some of you all should be, because you always ask, why do you have your shirt off? Now you'll be very happy to know I'm doing videos with my shirt on until my chest is ready to be shown to the whole wide world. So anyway, it's getting late here. It's about 10 o'clock at night. We're watching the news. I normally would have a vodka and cranberry, but not since I've had this surgery. I've had to cut that back to nothing. So I actually have some juice here. I'm sipping on some damn juice. I'm going to take one of these pain pills. I'm watching this news and go, my ass too bad. If you like my educational videos, please click what? Like. Share them with family members and friends and all my haters. Please let them know I'm alive and well. Them motherfuckers need to know that. Thank you for being a part of my life. If you have any questions about the surgery, don't hesitate to ask any questions. So I do these videos because, like I said, I want us to be able to talk and discuss it. I hate all this hiding that we do as African Americans. We hide so much. We don't discuss certain things. I know a lot of brothers who've had this surgery and they don't want to tell nobody they've had this surgery. For me, it's no big deal. This is a very common surgery, and I wanted to share with you all what I'm going through, and I look forward to sharing you all progress pictures that things as it gets to a point where I feel comfortable enough to show you our picture. Right now, we not ready for that. So anyway, I'm out of here. Enjoy your Sunday, and I look forward to you all's comments and questions. I'm out.